name's Summer Mayfield-Lay and I'm here with Ross Ballie to talk about the CRE IQI project. Would you like to introduce yourself?
Yeah, thanks Summer. So Ross Ballie, as you say, I am currently the Director of the University Centre for Rural Health, but the reason why we're here is because I lead the Centre for Research Excellence, and this is one of our biannual, twice-yearly meetings where we're trying to get together a whole range of people from a whole range of partner organisations.
Can you tell us a little bit about the CRE, what it stands for and what you're doing?
Yeah, so it's a Centre for Research Excellence in Integrated Quality Improvement, so you would have gathered that we're very much about improving the quality of Aboriginal and Torres Strait Islander primary health care and using systematic processes to support primary health care services to improve the quality of the work that they do, but coming at it from a very much a comprehensive primary health care approach, but also coming at it from a systems thinking approach, so really understanding that the quality of care, of course, it's the people who are working in frontline health services are very important in ensuring people are in the community get good quality health care, but their ability to actually do that job well depends on a whole lot of other things that are operating in the system. And so the challenge is for us, and what we really do through this research is understanding how can we support the system and various elements of the system to work better to ensure that people in communities get this quality health care.
Awesome. So this is you're 4 years through your 5-year CRE.
Yeah.
What are some of the key highlights out of the CRE today? I know they've got a lot of projects, but what have been your key highlights, do you think?
Yeah, look, the most exciting thing is the collaboration and bringing people together and really just how much we can learn from working together. You would have heard this morning just the diverse range of roles and organisations that people come from to these meetings, and what that does is, like you would have heard me talking about our all teach all learn approach. So there are no experts in this because nobody has a good understanding of how the whole system works for other people's jobs. And so some of the greatest things from my perspective is just those opportunities for learning together about how the system works and how can we work together to make the system work better.
I did actually notice how many people are here, and it is actually a large amount of time out of people's week to come, so the fact that you're able to get so many people here does show that the collaboration is really strong.
Yeah, it's always, I think it's a really interesting question for me is why do people keep coming back? Because, clearly they do keep coming back. You'll have seen that many people who are here have been to many meetings previously, but there are also new people who come, and some people sometimes drop out for a while and then they come back. So, from my perspective in trying to lead a project like this and thinking into the future is how do we kind of sustain this collaboration and that opportunity for learning is understanding what do people get out of this that causes them to keep coming back, and what is it that why do new people keep coming in? Because as I said, it's very much we aim to run this as an open collaboration, so we really welcome new people coming in.
No, it has been a fantastic day. And I'm pretty sure that everyone, which is why it's gotten quiet, is moving back in.
Yeah.
So is there one other thing maybe that you want to highlight has been a success from the CRE IQI?
A success, clearly the research projects are important, but I think the CRE is about supporting the collaboration. One of the things that comes out of that collaboration is that we're able to design projects that connect with multiple different parts of the system and get funding for research that kind of is a system-oriented research. And so we've had some very exciting projects that have grown out of this collaboration. And one of those you would have heard a little bit about this morning, and you'll be talking with people this afternoon, is the Worm project. And what's exciting about that is that there is a real challenge in understanding, well, how do we get good connections between primary healthcare services and communities and people in communities, and how do we enable, support people in communities to influence the quality and the way that primary healthcare services work in a way that actually meets their needs. So that's an example of a project where it's, it is connecting with one of the priority areas for development that has been identified through all the work that we're doing with key groups and the collaborations.
Very cool. And one of the things that people probably don't realise is it's not just a bunch of researchers sitting in that room. There are policymakers in there are people from peak bodies, there are people from the ground, and I noticed that you do actually have a strong focus on making sure that there's community involvement in your research projects too.
Yeah.
Fantastic. Well, thank you.